medical treatments for hair loss today really, to me, boil down to what I call the tried and true and proven things to use. And basically, to me, that's just a couple of things. We used to think that the reason a guy or a girl was losing their hair was mainly just due to testosterone. But we really found out that it was due to another product very close to testosterone called dihydrotestosterone. So once that was discovered, then came along a blocker so that you don't get the dihydro to cause the baldness. And that, of course, is filled by Propecia. I still think it's a mainstay, the number one, sound like a little advertisement here, and I can tell you I use it myself. It stops the hair loss. Patients can see less hair and they can see their growth, and they can see, some don't see the growth, but they certainly see the rapid progression come to a halt. So that's number one, and I offer it to every patient who comes for a consult. And certain women can even qualify as good candidates for it, even though it's not specifically approved for women. But other than that, I feel that when you hear so much on the internet, on the news, on advertisements, patients just don't know what to do. Should I take this herb or this vitamin? And some doctor's always coming up with the Norwegian formula, this formula and that formula, and selling it and doing infomercials. Well, when it comes down to it, there's no hard, fast data. What's going to happen is when that's all said and done, there'll be one rich person after that and a lot of disappointed patients. And I have to hear that every day for this brand and that brand. And it's just endless. You know, there's no easy way to weight loss, easy pill to weight loss. There's no cancer cure that anyone has. There's nothing that makes your genitals grow bigger, and there's nothing that makes your breasts grow bigger, and there's certainly nothing that makes your hair stay, grow out, that's been proven. Propecia, however, will come the closest to satisfying the most patients with the least side effects. 2% maybe, but most of my patients, 98%, have been real happy with it. So that's number one. Now quick second would be Rogaine. It's been around a long time, now over the counter, can be combined with Retin-A or other things, but still, combine that with Propecia for the person who really needs that combination. I think it's better than either by themselves. So that's what I would say is good. And third, I recommend patients to shampoo every day. It doesn't matter what kind of shampoo you use. You can start with Nioxin and DHS, or you name it, Prel, or your favorite shampoo. What that does is that cleans out the oils that are sitting around there that may or may not contain hormones that are sitting on the scalp, and removes them away. So I think that's another thing that I recommend to patients on a routine basis.